Hello. Okay. Record. So, respiratory system, when we talk about the structure, we tend to divide it into two main parts. And so, what I'm going to focus on is, and so far, you've realized that I want you to know the order of things, so there is, when we say the respiratory tract, what are all the parts along the respiratory tract? What are their functions along the respiratory? But we divide it into upper respiratory and lower respiratory. Now, the lungs, which I'll get into, are considered part of the lower, think lungs lower. And then things like the nasal passages are part of the upper respiratory tract. Now, the thorax, we'll get into what role the thorax plays within the respiratory system. First thing is what the respiratory system is responsible for, which is obviously respiration. So the act of rest, now ventilation and respiration are a little bit different. Respiration is the act, it's like when you bring oxygen into the body and it reaches the body's cells. Like oxygen has to go into the cells, and then carbon dioxide moves in the opposite direction. So that's a respiratory cycle. Bring oxygen in and have a way for CO2 to go out in the opposite direction. There are two phases to respiration that you need to know, and hopefully you're taking notes, because there's external and internal. External respiration is every part of respiration happening from the capillary all the way to the nasal cavity. So when the animal inhales, oxygen goes through the nasal passages, through the trachea, into the lungs, into the air sacs, which are the alveoli. Even though the lungs and the alveoli are internal, meaning in the thorax, that's still considered external respiration. When I say internal respiration, that is when the oxygen diffuses into the cell, internal or into the cell, and CO2 goes the opposite direction. So internal respiration happens at the cellular level. That's when carbon dioxide and oxygen are exchanged. But everything up until then, even though it's internal inside the body, is considered external respiration. So to achieve internal respiration, oxygen has to get into the cell and CO2 has to go the other way. Now, the respiratory system is also responsible for what we consider like secondary functions, which is, obviously the primary function is CO2 and oxygen exchange. But it also, this is how the voice is produced, how the animal regulates body temperature. The respiratory system has a role. The acid-base regulation, which acid-base balance is basically the acidity content of the blood, which affects the cells. So we have to have an animal that, maintains normal acid, what's called acid-base balance. Remember I said normal pH of the blood is 7.4. So when acid concentration tends to shift, if that concentration starts to move from base, the respiratory system has a role to try to fix that or adjust that. So the respiratory system, there's lots of things in the body that balance acid-base balance. You'll probably talk about it in chemistry some, but the respiratory system does influence that as well. And then obviously sense of smell is related. Now, part of sense of smell is sensory, part of your nervous system, part of, the nasal cavity, but the respiratory system has a role. So I'm going to talk about the structures. Oops. Sorry, I may have to, there's some slides missing on this. I may, if you've printed this, well, no, sorry. We're okay. I'll double check this PowerPoint, but sometimes I have a couple different versions. But let me talk about because I'm going to talk about oxygen and carbon dioxide exchange coming up. But let's talk about the different secondary functions, which first, if we think about your voice production, which is called phonation, and the ability to produce a sound, starts in the respiratory system. So the larynx is considered the voice box. And the way I tell students to remember this is you think larynx, lyric, or singing or voice, larynx, lyric. But the larynx contains the vocal cords. In animals, I tend to call them vocal folds. But what happens is when air comes in through the larynx, across the larynx is stretched the vocal cords. And when air vibrates, it's going to produce a sound. Now, I'll use my own dog as an example. Now, sometimes AJ goes outside and he's got this really deep, menacing bark. And then sometimes there's that bark that's playing, it's very yippy. Well, they can adjust the tension on the vocal cords to change the pitch, almost like you would change, like a guitar string. You can put tension on a guitar string and change the pitch. Well, if you think about vocal cords like these strands or strings, if they can adjust the tension, it'll change the pitch. So, there's a deep growl, there's a yippy bark, and basically the tension on the vocal cords is what changes the pitch. Now, remember, a lumen is an opening. So in the opening to the trachea, there's going to be the vocal cords kind of go across, like they're like in a V formation. But basically, when air moves through that lumen, it vibrates and causes the sound, which is what we hear. And that's the basics of a voice. Now, part of the respiratory system is also responsible for temperature regulation. If you remember the tissues lining, so when I talk about lining the respiratory tract from the nasal cavity to, the nasal opening, nasal cavity, back of the throat, in the trachea, there is a lining of a mucous membrane, and there are blood vessels in that lining. So what happens is, and look at this picture, pseudostratified columnar epithelia, cilia, mucus, if you remember that from tissues. Well, underneath those tissues is you have these blood vessels. So these are openings. So what can happen is when an animal inhales, first of all, those vessels can open up and give heat and can humidify the inhaled air. So basically, cold air or air coming in, oxygenated air, should be warmed or humidified. But they can also open up those vessels and dilate to let off body temperature so the animal can pant and relieve heat. So those blood vessels can, if it dilates, it's going to give off heat. If they constrict, it can conserve heat. But basically, there is a warming and cooling aspect to the respiratory tract. And again, if an animal's panting because they're hot, they're trying to relieve and release heat. And that happens within the respiratory system. Now, this is a good picture. Again, if you remember, why is the lining of the respiratory tract ciliated? Why does it produce mucus? And what is the purpose of cilia? If you remember, you got to dig. Yes, to trap debris, exactly. So it allows for absorption, and it also traps because, so like what Courtney and Morgan are saying, as they inhale, there's dust and particles and pollen, and, hopefully it traps that, and then they can cough or sneeze and expel, and it prevents it. It's like the first line of defense. So that stuff doesn't go, because remember, the respiratory tract is basically one series of tubes from the nose all the way to the lungs. So we don't want things to get down in the lungs into the deeper respiratory tract. So that whole lining is protective. The cilia is protective, and the mucus is protective. Okay. Now, if you remember, I was saying in the beginning what acid-base balance means. But basically, the whole body, all the body systems are supposed to work together to create homeostasis. Well, that's when everything in the body is in balance. We're kind of like, everything's kosher, everything is in balance. If for some reason, internally, there is a disruption in that balance. So normal blood pH that you need to know for the test is 7.4. Basically, that's base. And, you know, it can go 7.35 to 7.45, but I want you to know 7.4 is base. When it goes down, if it's becoming acidic, remember if it's below 7.4, it's becoming acidic. If it's above 7.4, it's becoming alkalytic. And, you know, you don't want it too high, you don't want it too low. We kind of want it in that 7.4 range. Well, what can happen is, you know, pH, normal pH allows for normal cellular reactions within the body. So when we start to go above or below, we're affecting cellular function. And the respiratory system is going to adjust, because what can happen is CO2, which is carbon, you need to know these abbreviations too. CO2 stands for carbon dioxide. There's a normal carbon dioxide, which is 40. So 40, and I'm going to type that so that you guys know that. And I'm going to come back and explain this a little more too. So don't worry, I kind of beat this concept to death, but sorry, I'm going to try to type. Okay, so 40 is normal carbon dioxide. What can happen is, and I'm going to get into this, when CO2 goes up, pH goes down. And when pH goes up, CO2 goes down. They're called inversely proportional, meaning when one does one thing, the other thing does the opposite. What can happen is, this is very basic. When an animal has too much CO2, they can increase, the way to get rid of it is to increase respiration. The more you breathe and the deeper you breathe, the faster you get rid of CO2. So what will happen is, if the body detects too much CO2 or too basically, you know, too low of a pH, it can cause the animal to breathe more. And what the body's trying to do is like, hey, get rid of CO2 and hopefully my pH will begin to normalize. Okay. So very important thing to understand is that when an animal exhales, they get rid of CO2. So it only makes sense, if I have too much CO2 in the body, I got to breathe more. I got to get rid of it. And so if there is internal acid-base balance problems, sometimes the body will recruit the respiratory system to try and help fix it. Now, it might not be a respiratory issue, but the body's like, hey, if you breathe more, you could help fix my pH. So there is a relationship to that acid-base balance and pH and, you know, carbon dioxide. The other part of the respiratory system is sense of smell. So when we talk about, which is the olfactory sense, now there is a separate kind of like sensory lecture that I hope I get to. Sometimes I end up having to cut that one short due to time, but there are receptors, sensory receptors that will pick up scents. Now, this is high within the nasal passage, so it's not necessarily right at the surface. I don't know if you've ever, like taken your dog for a walk, or you've noticed sometimes I've seen cats do this. They'll go to smell something and they get up and they're like opening their mouth. And it's kind of like, if they go over on the carpet and do that, I go smell, because I'm like, they smell something. Yes, Catherine, if you see your cat do it, like my cat was doing it once, and I think one of my dogs got the anal glands on the carpet, because I went over there and immediately, because I'm like, okay, what do you smell? When they do that kind of smelling and they've got their mouth open, they're trying to pull the smell back into their deeper nasal cavity and reach really their olfactory bulb is deep in the nasal cavity. And that's when they're really trying to pick up a scent. You know, there's sniffing that's like, you know, and that's a little more, I mean, they're still smelling, but if they do that open mouth, they're really trying to pull that smell back into their nasal cavity. It usually means they smell something real good, or to them good, to us bad. But the one thing I want to mention here that's kind of like a clinical tip like for when you guys are in practice or in kennel or your own animals. Cats' drive to eat is very tied to their sense of smell. So cats have to be able to smell their food to want to eat. Where I get concerned is if you have a cat, and a lot of times we get cats from the shelter, and when they first come, they break out with an upper respiratory infection. Sometimes the stress of travel, the stress of a new kennel, sometimes they're around each other, and upper respiratory around cats can spread like wildfire. But if you have a cat that has an extremely goopy nose and they've got the goopy eyes and they're kind of like slurping when they breathe, or they're really crusty nose and they can't breathe, a lot of times those cats will not eat because they can't smell their food. And you'd think an animal would be hungry enough, like, you haven't eaten for a couple days, you got to be hungry. But what we can try to do is you can try to clean their nose off before you feed them. But one thing is to use smelly food. Is if something is kind of like, you can get cat food that are like salmon or tuna, fish flavored. Also, a lot of people will put canned food in the fridge, and most animals will eat cold canned food. But if it's a cat like that, I try to add like warm or hot water, try to make it aromatic. You have to be careful when you microwave canned food, but if you give it like a quick zap to heat it up, sometimes if they can smell it better, they will eat. If I'm very desperate, you can use like at our hospital, we always kept some cans of tuna, but I call it like kitty crack. I'm like, okay, once you give the cat tuna, they're like, the next time you go to feed them regular food, they're like, well, I had tuna yesterday. What's that? They kind of like might not want to eat it. But if you take, sometimes what I've done is I've just squeezed some of the juice from the tuna can onto their food. And of course it's very smelly. And sometimes it'll get them to eat. So sometimes, and that's particularly, I notice it more in cats than I do dogs. But if you have upper respiratory patients, watch their eating, especially if it's a cat. And cats get upper respiratories much more frequent than dogs do. It's just much more common in cats. So that sense of smell, and unfortunately, I had an oncology client, and the poor cat had a big oral mass, and it was invading the nasal cavity, and it was just a really bad tumor. But the lady was very interesting, but she was like, do you know if my cat can smell normal? And I was kind of like, I didn't know how to quite answer her question, but I was like, I can't really, they can't tell me. I can't be like, does that smell like tuna? Or can you smell that chicken food? I have no way. I said, you could try to feed the cat things it likes, or get some, sometimes when cats won't eat in the hospital and we try to feed them a very healthy hospital diet, we have a box of like Friskies, just like kitty McDonald's or, kitty junk food. We keep a few cans of some really kind of smelly, junky food. I know it's not an ideal diet, but sometimes we can get them to eat. But I just told this owner, all you can do is try to feed a few different types, create like a kitty smorgasbord. And another tip related to eating, and I think this is, I know I'm getting off the topic of hair, but I think it's important for you guys to know, getting cats to eat can be challenging at times. I had a cat that didn't like, so there's sometimes the food where it's like little bits of food, but then it has a gravy. Well, she would just lick up the gravy. She didn't like the bits. She also didn't like the pate. So there's like usually food pieces in gravy. And then there's the pate form, which, is like, comes out like a chunk of food. And some cats, my old cat didn't like cat food or canned food. She only ate dry. So sometimes you try to feed a cat in the hospital and everybody assumes that an animal's going to love canned food. Not my cat. She would only eat dry food. So sometimes you literally, it almost looks like a smorgasbord. I had a hospitalized one of our oncology patients, and we were having a hard time getting her to eat due to her cancer, but I would have like 5 or 6 different things. And she liked the hard kibble. I finally found a kibble that she liked. but forget all the canned stuff. So get creative. You know, they're not normally, you know, an over-the-counter food kind of, you know, dogs, we can go get an Arby's sandwich, or sometimes we get lunch meat, like lean turkey, roast beef. Some cats will eat that, but, you know, tuna, a few cans of tuna in your hospital could go a long way. So that's all related to smell, but an important thing to understand. Now, those are like the secondary functions, but let me talk about the actual structures of the respiratory tract. And it's basically a series of tubes leading to the lungs, which are open to the outside. So basically from your nasal cavity to your lungs, open tubes. But we've got, if I say upper respiratory tract, that's any structure outside of the lungs. Okay, so as I talk about a structure, if it's outside of the lungs, it is considered upper respiratory tract. Now I'm going to talk about the trachea. The trachea goes into the thorax, but it is technically an upper respiratory tract structure because the trachea is outside the lungs. So even though the trachea is inside the thorax and you think, okay, that's lower, it is part of the upper respiratory tract. So anything outside of the lungs is considered upper respiratory. The lungs and any structures inside the lungs are called lower respiratory tract. And that would be like your bronchi, your bronchioles, your alveoli, and the lungs themselves. So I consider the lungs, but when you guys learn respiratory diseases, and I think you guys, I don't know if you've done vaccines yet in ClinMed 2, but when we talk about, you know, a cat with an upper respiratory tract infection, what's usually affected? The nose, and then there's coughing, okay? But when we talk about lower respiratory tract diseases, that would be like pneumonia. Pneumonia affects the lungs. Now, they don't, now sometimes they can have nasal and ocular discharge, but for the most part, it's like where certain diseases of the respiratory system affect certain parts of the respiratory tract, and that will be important. This is a picture that's going to be on the test. So this image you will need to know for the test and be able to label and answer questions. So just make sure. But here is a good list on slide number 9, is all of the structures that are considered upper respiratory tract. So, and we're going to work our way down. Starts with the nostrils, which is right, you know, the opening to the nose. Behind that is you have the nasal passages back here. So that's the, so, and think about, I'm always like, how do we follow directions? If an animal inhales oxygen, it has to go through the nasal cavity, or through the nostrils to the nasal cavity, nasal passages. It's going to pass through the pharynx and the larynx, and it's going to enter the trachea. This is the order. And let's talk about each part. So again, this picture will be repeated. So when we look at the nasal passages, I want you to know the name nares. So the nasal passages are typically called the nares. For example, when I was talking in anesthesia, I was talking about why bulldogs and pugs are challenging for anesthesia. And they suffer from something called stenotic nares, which now stenosis means narrowing. And so if an animal has stenotic nares, this is genetic in these guys, the nasal passages are small or narrow. And that's another thing that just makes it harder for them to breathe. They have a whole list of issues, but stenotic nares is a condition that they can suffer from, meaning they're narrowed. So we always, I don't refer to them as the nostrils. If I'm talking about an animal, they are nares. But it is the most rostral part of the respiratory tract. If you remember rostral, which is closest to the nose, that's the very first opening to the respiratory tract, is the nares. Now, the nasal passages are going to be caudal to that. So if you look at the picture that I'm pointing, you've got the nares, and then it's going to go through these nasal passages. And this whole area is called the nasal cavity. Now, do you see this? It says hard palate. Basically, between the upper teeth, okay, and if you put your tongue up there, that's hard. That's your hard palate. Your soft palate is more caudal. That's like the very back of your throat. But the hard palate is like the roof of your mouth, the hardened part. So the hard palate is a bony structure, but the nasal passages lie above the palate, okay? If you have an animal like a puppy that's born and they come out with what's called a cleft palate, they literally have a defect or an opening in their palate that opens to their nasal cavity. So the problem with puppies with cleft palates is that they'll go to eat and drink, but what happens is sometimes some of that food or milk can get up in the nasal passages, and then they can inhale it, and they can get coughing, they can get aspiration pneumonia. So cleft palate is something that really probably needs to be surgically corrected, if possible. I mean, if it doesn't get surgically corrected, you know, you have to feed them a certain way and a lot of nursing care and watch for aspiration. But that's what a cleft palate is. It's basically an opening in this hard palate, which allows food and water and milk or whatever to get up into the nasal. So that hard palate should be intact, and you know, it should protect the nasal cavity. Now, there's a line here that says, well, I'm going to come to that in a second. The midline, now this is just a side image, but if you look at the front of the nose, there is a divider here called the nasal septum. Okay, so the septum, remember, a septa is a divider. The nasal septum divides, you know, you got your right and left nostril, but the septum is a bony structure covered with soft tissue. It goes all the way back and it separates. There's a right and left nasal cavity. And they should not go back and forth. We want things to be on one side or the other. Is cleft palate random or genetic? Well, it's more random than genetic. But what I'm saying, but it is a birth defect. So yes, you can have a litter and have just one puppy, and like maybe 8 puppies are normal and the 9th puppy has a cleft palate. So some, you know, it's really more of a birth defect. And I wouldn't say, it's not like, I can't say just Pomeranians, Bostons, pugs get them. Any breed, cat, dog, whatever, calf, can get a cleft palate. So it doesn't necessarily have a genetic disposition. It would just be maybe there, you know, for some reason it didn't develop normally in that offspring. Does that make sense? Yeah, okay. Yeah, and so one thing, if you do a C-section, or if someone breeds their dog, you know, usually right after they're born, we always open up and check and look for a cleft palate. You know, you'll probably discover it in a week or two when you've got one puppy choking and not eating well, milk coming out their nose, you know. So sometimes there's signs, but any C-section or animals right after they're born should be examined for a cloth palate. It's been a long day. I'm going to really try to lecture and talk normal. Okay. Okay, so the septum normally divides the right and left nasal cavity, and there shouldn't really be a communication to those. Let me say something about that, because now a lot of times when an animal has a like an upper respiratory, and sometimes they have nasal discharge, or even sometimes with pneumonia, it progresses and they get nasal discharge. A normal respiratory infection, you should see discharge from both nostrils. Okay, so normally if it's infecting the whole respiratory tract, it's going to affect both sides, and we should see bilateral, both side nasal discharge. One thing that I saw, especially working in oncology, is a lot of our nasal tumor patients came in with what's called unilateral nasal discharge. And what's happening is because the tumor is only affecting one side. So if you have an animal that has a persistent unilateral nasal discharge, and they're an older dog and they're pawing at their nose and sneezing a lot, because I've seen some of, and let me explain why I'm saying this. I've seen a lot of our nasal tumor patients come in for, they've been on antibiotics and steroids and treatment at their regular vet for 2, 3, 4 months. And it's a unilateral discharge that isn't going away. If it's an upper respiratory infection, a lot of times it's bilateral. The other thing you have to think about is a foreign body. And sometimes that's in the history, because we had a dog come into the ER and the dog was sneezing and pawing at its face like feverishly. But when I started taking the history, and the dog is, now he didn't have a lot of discharge. He was sneezing, maybe a little bit of clear bloody discharge, but it was minimal. And I was like, well, how is your dog feeling? How has he been acting? I was trying to get an idea of activity. And I realized, he goes, well, oh my gosh, he's on the farm. He's going crazy. He chases the mice. So first of all, I'm like, okay, he's a farm dog. And I said, oh, he likes to chase the mice. And he goes, yes, he dives into the hay bales after the mice in the barn. Well, when I heard diving in the hay, sure enough, we sedate the dog and we take a scope, and he had a piece of the barbed hay stuck way up in his nasal cavity. So probably when he dove in the hay bales, a piece of hay like got up in, we had to take these long forceps and pluck it out. So that's why it was one-sided, So sometimes dogs will get a foreign body or get a piece of wood or mulch or hay stuck up there. But I just want you to be aware, there's a difference between bilateral and unilateral nasal discharge. A cold and upper respiratory versus something that's just affecting one nasal passage. Wow, I don't know what to say, Chance. Wow. I've never seen that. My daughter, I'll never forget, I was sending her to my mom's for a week. My mom's like, I'm gonna, keep her for you for the week. And she was like 5 or 6 years old. And she had just one side of her nose was runny. Like, she kept getting a runny nose. And I told my mom, I said, I don't think she's getting a cold. I think I said, I don't know what's going on with her nose. She just had a little nasal discharge. And I was like, she was 5 or 6 at the time, whatever. So I go to pick her up a week later. We meet to have lunch, and because she was going to Chicago. Anyway, we're at lunch, and my daughter sneezes, and she's going to be mortified I'm telling the story, but a Polly Pocket shoe came out of her nose. And I don't know if you know what Polly Pockets are. They're these tiny little plastic dolls, and they had little clothing, and you could slip on their plastic clothes. And of course, the Polly Pocket shoe is tiny. For some reason, she put M&M, or she put the Polly Pocket, but because she had the foreign body, she had unilateral discharge. Because I'm like, if she's getting a cold, this is my kid. I'm like, if she's getting a cold, I would expect both of her, and she didn't have a fever or coughing. Yeah, I waited a long time, Cassidy. She wanted Polly Pockets forever. And I was like, okay, now I think you're old enough to not eat them, swallow them. But yeah, for some reason, she felt like putting one in her nose. So that's just a clinical tip. Yeah, she did prove me wrong. That's just a clinical tip that, you can have something wrong with one side, but it is rare. Normally, like, infections can affect both sides, but they don't communicate. A lot of our dogs that had nasal tumors affected one side. The other side of the nasal cavity was completely normal, which was a common thing. Now, I talked about the nasal passages already, but within let me go back. Let me talk about the turbinates. So within the nasal cavity, if, there's nasal turbinates. Now think of turbinates like a turbine. like circle. The other thing these are called is, yeah, I agree with you, Rachel, on that one. Normally, or the turbinates are also called nasal conchae. Now, if you remember a conch shell, it's like the shell you listen to on the beach and it's swirled. So that conchae, or C-O-N-C-H-E, is that swirled appearance. That's where that comes from. Inside the nasal cavity is a series of swirled bones. And I remember when we did the skull, I showed you guys a picture. It looked like the nose was cut off and you could see the swirls. So the nasal conchae are these turbinates, and when air comes in, it goes through these turbines. Think air turbine, turbinates, but it can warm and humidify. But there's nasal passages. The one I want you to know is the ventral nasal meatus. So there's a dorsal meatus, a middle meatus, and a ventral nasal meatus. The reason this is important, when you go to do like nasal feeding tubes, so we can do what's called a nasopharyngeal tube in a cat or a nasoesophageal tube. You learn that in Tech 6. But the landmark to place the tube is you're going to pass it through the most ventral, I'm going to make sure my pen's not on, but you're going to go through the most ventral part and the most medial part, and you're going to lube the tube and you slide it through, and it's going to slide through the nasal cavity to the back of the throat. And that's how we can do tube feedings. Because if an animal's not eating, especially in cats, sometimes we have to do tube feedings. It's kind of like force feeding. But we can make like a liquefied diet and do a tube feeding into the back of the throat. But the landmark, I'm going to tell you, if you just put if you put a feeding tube and you just aim inside the nose, a lot of times you're going to get about maybe 2 inches or so, and you're going to hit something, and you're hitting those turbinates. If you need to get to the pharynx, you need to go through the ventral nasal meatus. And then, I tell students, if you hit something, you just have to back it out, aim ventral, aim medial, and slide it back again. But a lot of animals get, like large animals get nasal tubes if you're treating them for bloat. Sometimes we're giving horses mineral oil. Sometimes we're doing them in cats because we're doing a feeding tube. Sometimes we're passing nasal oxygen. There's a lot of tubing that can go nasally, and this is an important landmark. And that's why I want you to know the ventral nasal meatus, is because that's where you pass it. Okay. Now, inside those turbinates, in the nasal passages, they are lined with mucosa, mucous membrane, and it has this ciliated epithelia, the pseudostratified columnar epithelia. It creates mucus. It's protective. And the nasal passages should warm the air, humidify the air, and filter the air. So I do want you to know that for the test. What do the nasal passages do? They got to warm everything coming in, add moisture because air is dry. So part of the nasal passages help moisten that, which is going to be good for the tissues. Sorry. Okay. Sorry, someone was trying to message me about school. That's going to warm the air coming in, but it's also filtering so that, debris, and I think I've already touched on that. Part of the back of the nasal passages, and this is associated with the skull as well as the nasal passages, is we have sinuses, and it's basically called a ciliated outpouching, or a pouch, an air-filled sac within the skull associated with the nasal passages. Now, they are named for where you find them. So there can be more sinuses. I'm just stressing the maxillary sinus and what's called the frontal sinus. Now, the frontal sinus would be like right here, and that's the frontal bone. And then the maxillary sinus is found along the maxilla. Now, there is a question on your homework, and I'm just going to try to explain this right now. It says, what is housed or contained within the maxillary sinus? If you look at where this tooth is, so this is this is molar 1, 2, this is premolar 4, which is also sometimes called the carnasal tooth. The tooth, what you see on the outside, the roots are going up into the bone, okay? But the tips of those roots can go into that maxillary sinus or can communicate. Um, let's see. Let me see if I can pull this up. Sometimes I try and do this and it backfires. Oops. So hopefully you can still see. Yes, Rachel, I was getting ready to say that. Yeah, if you guys have ever had like hopefully you guys can still see my screen. If you've ever had a really bad sinus infection and sometimes you hold your forehead and you're like, oh my God, my head. Well, these pouches, these sinuses, do not stretch. They're contained within bone of the skull. So if they fill with mucus, you're going to get a lot of pressure and it's going to push on the skull. So if you have a sinus infection, or sometimes if you've had a sinus infection, you feel like your teeth hurt or it hurts to chew, it's because the roots of your teeth do communicate with the sinus. So if you have sinus pressure, it's going to put pressure on the roots of your teeth, which it could hurt to chew. And sometimes, and then we've got sinuses right here. So sometimes like I've had it here where just like to touch my face hurts here, or when you chew. We don't deal with a lot of sinus infections in dogs like we do in people. But one thing that you might see is something called a tooth root abscess. So let's look at this dog. Nice little Clumber Spaniel, which you don't see a lot of. But, you know, a lot of times what owners will do is they'll call you and, oh my God, my dog has a tumor on its face. And it just showed up yesterday. Well, it's not super common that tumors grow over a day or two. I mean, this is concerning. I mean, look at this dog's face. See this? And sometimes they're like, I can't see my dog's eye. Look at this poor little guy, little dachshund. Okay, sorry, I don't know why it's not focusing on the image. Okay, but you can see sometimes it's minimal. So like, look in this dog, you know, there's a swelling here, but what happens, and sometimes you guys see it. Now, sometimes what will happen is the owner won't necessarily know that it was swollen, but what's going to happen is they've got what's called a tooth root abscess. And what happens is if there's damage to that tooth, sometimes bacteria can migrate up into, and what happens is when the sinus swells with, you know, an abscess is a pocket of pus. But the problem is abscesses have to be lanced, or sometimes abscesses rupture on their own due to pressure. So sometimes an owner will come in where it's already ruptured and they're like, something bit my dog's face. Or, you know, and obviously if the dog didn't get into a fight with another dog, I mean, what does that happen from? But a lot of times they don't even realize it's a rupture of, oops, that's not what I wanted to do. Sometimes they don't know that it's actually ruptured. But here is the tooth. Okay, it's kind of hard to see right there, but let me get to, so here is the carnasal tooth. And what we're looking at here is this is what's called a slab fracture, where like a piece of that tooth, like a slab, has broken off. And there's a problem here is that's created an area where bacteria migrate up into the sinus. So a lot of times what happens is here's the tooth that's affected. Okay, so we've got canine 1, 2, 3, and this is the 4th premolar, and then we've got the 1 and 2 molars back here. But this is where, you know, it can migrate. And here's a picture, like if you look at the skull, here's that tooth, here's where the sinus is, and it can abscess. So I bring up the maxillary sinus because this is, you know, something fairly common that can be seen. And sometimes sometimes what happens is the swelling is so bad, they can't completely open that eye. So sometimes they come in with a squinted eye, sometimes it's a swelling. The way we treat it, typically, if a dog comes in like, well, that's not the greatest picture. Okay, so if a dog comes in like this, we can do a couple things where they will actually lance this, and this is a better picture. So sometimes what we'll do is we'll put a needle in there and drain out, or like we'll make a hole, drain out the pus and flush it, and then it has to just drain on its own. For usually 2 or 3 days, the dog goes home and it just has to kind of heal. Sometimes we will go in and remove this tooth. So we'll do a dental, remove this tooth. You still have to drain the abscess, but sometimes I've seen doctors actually leave this tooth in and just treat the abscess, because sometimes the tooth looks remarkably well. So are there any questions about that? I only stress that because, you know, it is something fairly common that can be seen. And again, the problem with these sinuses, they don't stretch. So when they fill, now you could potentially try to put them on antibiotics, but the problem is with an abscess, you got to get the infection out. And the only way to do that is to lance it. Sometimes, some abscesses will rupture on their own, and the owner finds the evidence after it's ruptured. So let me talk about the back of the throat briefly here. So the pharynx is considered the back of the throat, and it's P-H-A-R-Y-N-X, but I want you to know, don't say throat, do refer to it as the pharynx. The things you need to know, it is the common passageway for respiratory and digestive systems. So if we look at this picture, do you see there's an arrow pointing to, so the top part here, this opening and this opening are the part of the pharynx. Now, the way I remember, now it is divided by the soft palate. So if we go to the back of the throat, the soft palate separates what's called the nasopharynx from the oropharynx. Naso, pertaining to nasal, is the nasopharynx, is the nasal portion of the pharynx. Because if you go to the back of the sinuses and then it goes back here, it opens to the back of the throat. And then the oropharynx is below the soft palate, and that is the opening of the pharynx to the esophagus. Now, they do switch here. The esophagus is dorsal to the trachea. The esophagus is on top of the trachea. So when an animal eats, food and water are going to go into the esophagus. And when an animal inhales through its nose, and animals breathe through their nose, I mean, some animals are panting and their mouth is open, but the primary way an animal breathes is through their nose. Oxygen is going to come in through here and then come into the trachea. And that's the normal passageway. But the pharynx, the way I remember pharynx from larynx, because students get that mixed up, the pharynx comes first, pharynx first, and food passes through it. So I say pharynx, food first. It comes first before the larynx. The pharynx is before the larynx, and food passes through it. So pharynx, food first is kind of like a little clue to remember what is the difference between the pharynx and the larynx. Now, when it opens at the end, the pharynx will open to the esophagus, which is a digestive structure, or it opens to the trachea, which is a respiratory structure. Now, since we were talking about sinus infections in people, you know, if you've ever had what's called post-nasal drip, or you have a bad sinus infection and the back of your throat hurts, if you've got a bunch of gunk in your nose, a bunch of, nasal discharge, it will drip into the back of your pharynx and the back in your throat. And sometimes you feel like you're swallowing stuff. I'm trying not to gross everybody out, but that's because the back of your nasal cavity opens to the pharynx. And nasal discharge or post-nasal drip is where nasal discharge just kind of drips into the back of your pharynx, and it can give you a sore throat. But if you look at my picture, if I pass this feeding tube in, the feeding tube we pass down through the nasal passage and it goes down into the esophagus. So you can, like I said, you can do these tube feedings on, hospitalized patients. Sometimes we'll leave them in. A nasopharyngeal tube can stay in 3 to 5 days if you have a compliant patient. So sometimes cats with advanced liver disease, advanced kidney disease aren't eating well. We have to do tube feedings, and we can do that passively. I am going to stop there. Are there any questions?